Hi, welcome back. I have a subscriber who happens to be an X-ray tech, works in a hospital, asked and said, hey, I could use some more medical signs. I had a patient come in, I was able to sign a few things, I would sure appreciate more signs. Well, as luck would have it, as you can see, I injured my own hand, so my articulation might be a little less than normal, but here we go. Signs in a medical establishment, a hospital, a doctor's office, but especially helping out that subscriber who happens to be an X-ray tech. The first sign is one of my favorites when it comes to an ASL use where there's not an English word. All right, here's the first one. Ready? Pow. I take my fist like this. Here's an individual, a body. Pow. There isn't an English word here. What this is trying to communicate is this thing all of a sudden came upon me. So let's take an illness. Oh, I was sick. It just happened overnight. Pow. Okay, oh, okay, oh, my stomach ache, oh, bam, okay, pow, bam, immediately, okay. This is used to indicate something that just out of the blue happened, okay. You wouldn't sign it for a car accident, don't do that, okay, but in the medical field, let's talk about that, right? A disease, an illness, a fever, all those kind of things, right out of the blue, got me sick. Okay, let's do cold. There are two kinds of cold that you might have to use if you're a medical provider. You have cold. I am pinching almost and pulling out at the end of my nose. That sounds gross when I listen to myself, but that's cold. Okay, I have a runny nose, cold. Can you see that? Now I have cold. Cold, as an X-ray tech, he might ask an individual who's laying on that cold table for a different kind of imaging. Okay, hey, are you cold? Do you need a blanket? Are you cold? Do you need a blanket? Okay, so those are the two kinds of cold. Let's try fever. Fever. Okay, you're going to flip the hand back so the back of the hand is on the forehead. Ooh. And you're going to make it sound like you're kind of hot. It's a fever, right? Fever. Now, going along with fever, you have temperature, both, think of the old school mercury kind of thermometers. Two signs. Thermometer. Can you see this? This is how you'd sign it, right? The full hand, but there's also another sign, and it's just your index finger and your other index finger. Temperature. Temperature. So can you see fever, thermometer, and temperature, right, could all easily go together, right, for those things there. That's fever, thermometer, temperature, right? Let's do X-ray, right, the one that he's most worried about. X-ray is interesting. X-R-A-Y. X-ray. Now what I would do is I would go X-ray and I would have a sign. Boom. This is a sign for picture. Do you see the shutter opening and closing? Picture. Now, what's interesting about X-ray is you're going to have X-rays of different parts of the body. Ooh. What did I just sign? I'm going to take a picture or an X-ray of your elbow. How about of my finger, right? How about of my neck? So X-ray can be all over wherever that's going to be taking place. I could also sign this. X-ray. X-ray. So either one, if you set up X-ray and you give a sign, picture, that can be used wherever you're going to take that X-ray, or you could just go X-ray and move that around the body to where you might give an X-ray, okay? Let's talk about bone. You see my two pointer and middle finger, they're bent over like this, bones, okay? Bone, all right, bone. That's how you sign the word bone. Now, we're gonna have a joint, right? Knee, elbow, shoulder, two fists together. See how that moves? You can almost imagine your knee, can't you? Right? Now, what happened if your knee went like that? What just happened? Right? That's why he's in the X-ray room. Right? We're going to take a picture or an X-ray of your knee, right? Because it, right, came apart, broke, right? I've got a ligament tear, whatever. And you can also do the same with bone. Right? That's almost a little more descriptive to me. Right? I can see the bones and it's come apart. Okay? That's why I need the X-ray. All right? And then as the X-ray technician, he might say, hey, break, right? Or like this, how? This is the word for, this is how. Your thumbs up, you're rolling the four fingers, okay? As I'm trying to establish a great patient relationship. Hey, how? How did you break it or break like this? How? Okay, how did it happen? How did that break happen? Okay, now last in this set, as I think about having x-rays before, sometimes I'm being told to stay, to hold really still, to be patient, okay, and don't move. All right? Now let's not confuse that with patient, as in I'm a patient, because it's not the same thing. So let's sign patient, patient. A hand, thumb comes across the lips. And I'm going to say, oh, be patient, be patient. If I want to say hold, hold, grab your fist like this, hold, which means don't move. Hold it, okay? And you might do wait, wait. Both fingers, and then you go like this. Either of these signs would communicate, hold this pose during the x-ray, okay, while I'm taking these pictures. I want to do that again, all right? We've got be patient, a hand, cross the lips, wait, the four fingers of both five hands, waiting like this, okay, hold it, S hand, shaking like that, right? Those are some of the ways an x-ray tech could tell you to hold it while I take the x-ray. All right, let's move on to another set of medical terms. Okay, welcome back. Let's do some medical signs, right, in addition to the first group we did, all right? Here's the word that I think so generally you're asked. Hand like this, feel, feel. Do you see how that middle finger comes out like that? Feel. How do you feel? Okay, you're not signing, how do you feel? You're going, hey, right? I'm sympathetic. You can see it in the face. How are you feeling? Okay, I'm getting your attention. This is how do you feel? How are you feeling? Right? They might respond with nauseous. Ooh, my stomach don't feel so good. Okay, I'm taking my five hand. I am curling all those fingers, thumb and the four, and I am going in a rotational circle around my stomach. Ooh, wow, I'm nauseous. I don't feel so good. Okay, and you can see the concern on my face as well. Okay, for nauseous. I might feel weak. Flat hand here. This hand, do you see that? My knees look like they're buckling. Okay, weak. I feel weak. How about the sign for vomit? I'm going to take two five hands like this, and it's going to, right, vomit, to throw up. Okay, it's not both hands back. Okay, your dominant hand's out here in front. This one is right at the end of the first of the hands, to throw up, to vomit. Okay, how about cough? Okay, I have a fist, cough. Okay, I have a cough. Okay, how about a blood draw? Blood draw is interesting. I happen to be right-handed, so here my left hand, I'm going to pull out or extract right here in the elbow. Okay, oh, blood draw will be necessary. A blood draw will be necessary. See how blood draw is? I am grabbing with all the fingers. I am taking that blood out. That's what a blood draw looks like. How about blood pressure? Blood pressure, we think of the old school kind of machine. Remember you put your arm in the sleeve and they would pump it up? Guess what? That's the sign. Okay? It goes up. And so, oh, hey, your blood pressure is whatever the number might be. Okay? 120/80. If I take the American norm, right? Your blood pressure, got to hear you by the arm, your blood pressure, oh, it's 120/80. Right? And then last, let's do headache. 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 This is the sign for hurt. See how I twist it as I come together? Hurt. Now, this is one of those interesting signs. All right? I can have a headache. I can have a stomach ache. My elbow can hurt. All right? This is directional. Right? This is location based. This can be moved all around. So you can ask, hey, where do you hurt? And they might say, oh, this hurts, or my stomach hurts. Got that? Okay, hey, for that subscriber, I really appreciate you sending a request. If you've got a request, for your workplace or school or family or whatever, send it in. We'll see if we can't put a video together giving you some of the right signs for your situation, okay? Really appreciate you coming by. Would you subscribe, please? Trying to grow the channel. Would love to provide you the value that you're looking for on your ASL journey. All right? Thanks.